Welcome to Curiosity Matters. Today we're taking a deep look at health, not just as a medical outcome, but as an economic engine. How do we correlate a nation's pulse with its prosperity? When we talk about national budgets, health is usually framed as a drain, a bill that needs to be paid. But what if we've been looking at it backward? What if health isn't a byproduct of a rich economy, but the primary engine that builds one? Today, we're exploring the health-wealth loop and why a country's pulse is just as important as its GDP. As we saw in our deep analysis, fewer deaths, more genius, how Europe ruled the world, see the video link above. Health and reduced mortality can give an economy a massive competitive advantage. In economics, we use the term human capital. Think of it as the collective skill and energy of a nation. If people are chronically ill, they can't work, or they work less efficiently, a concept known as presenteeism. But the correlation goes deeper. Education. Healthy children stay in school longer and learn better. According to the World Bank, health is the foundation for human capital. Without it, you can't build a high-tech, high-wage workforce. You aren't just paying for doctors, you're paying for future innovators. Let's get concrete. Research from the World Health Organization suggests that for every $1 invested in health, there is a return of up to $4 in economic growth. Look at countries like South Korea or Norway. Their massive investments in public health didn't happen after they got rich. They were the ladder they used to climb. Conversely, look at the impact of the COVID-19 pandemic. It proved that the global economy is just a sub-department of global health. When the health system fails, the stock market follows. Then there's the healthcare sector itself. It's not just about spending, it's about jobs. In many developed nations, healthcare is the largest employer. It drives innovation in biotech, robotics, and AI. This is the multiplier effect. One nurse's salary supports a local grocery store, a car dealership, and a school. As highlighted by OECD health statistics, the silver economy, caring for aging populations, is now a multi-billion-dollar industry driving new tech markets. In this context, it is a great shame that some countries restrict access to medical studies by implementing a numerus clausus. Take Switzerland, for example, a country that certainly has one of the lowest mortality rates in the world, but sets such strict rules for access to medical school that some students are forced to pursue their studies abroad. According to the Swiss Medical Association and the Federal Statistical Office, as of 2024, approximately 41% of the 42,000 doctors practicing in Switzerland were trained abroad. While it is certainly extremely positive to have doctors from very different backgrounds, this is a poor long-term calculation and a zero-sum game. Wealthy countries, through their attractiveness, take doctors from less fortunate nations, further widening the global economic gap. So, here's the bottom line. Investing in medical education is the backbone of a healthy economy. A hospital is as vital an infrastructure as a bridge or a power plant. If you want a booming economy, you don't just need low taxes, you need healthy people. Investing in health is the most profitable decision a country can make. Thank you for joining this focus on Curiosity Matters. Subscribe for more rigorous explorations of history's turning points, where ideas, environments, and institutions shape the trajectory of civilization. Thanks for listening. Until next time, and stay curious.